All right, good morning, everyone. It is 9:03. Thank you for your patience. We're going to get going. I'm certain that people will straggle in as they finish their inboxes. We have three presentations today with two presenters, and we've actually switched the order today. So Louise Hansen is going to speak with us first, and she's going to speak about navigation in Durham Region. And many of you are part of our WhatsApp group, and if not, please reach out in the chat group to myself or Louise, and we'll get you added. This is a PCN DFCM chat group that has helped connect. I think there's over 250 members now in the chat group, so helping solve little problems every day. Today, I'm going to introduce Louise. We're going to take small breaks between the talks to allow people to go to the washrooms and get snacks, those sort of things. Otherwise, at the end of the session, Shannon will wrap us up and make sure that you fill out the survey and you get your accreditation for attending today. So let me introduce Louise. Louise is a registered nurse. She was educated through the Confederation College of Registered Nurses program with 28 years of experience in nursing, with 22 of those being in our Durham region. Her practices span rural hospital practices as well as an Indigenous community, and this has helped shape her patient-centered approach and her understanding of care across the region. Louise also should be noted to be, she's leading the WhatsApp group and running it in the background and running the SCOPE program that is new to Durham. So she's our go-to for all things consultation and research-wise. So let Louise take over the topic.
Thank you so much for that introduction, Dr. Kennedy. I will get my slides up. Hopefully everybody can see that. Perfect. So I'm here today to talk about SCOPE in primary care, real-time support for complex patients. So let's get right into it. So this is the first time doing a presentation of this type. So these first few slides are new for me. I have no financial sponsors. I have no affiliation with drug companies, financial relationships, or anything along that line. Like I said, no financial support, there's no conflicts of interest, and there are no biases. So today I'm hoping to cover all of this with you, and you'll have a better understanding of what the SCOPE program is by the end of my talk. So I will give a brief history and evolution of the SCOPE program, identify services and resources available through the SCOPE Nurse Navigator here in Durham Region, some key lessons that I've learned from implementing and operating the program here in the region. And at the end, I will explain how you can access the services, how you can register for the program, and how you can reach me for all things that you need support with. I always like to start with this slide when I'm talking about SCOPE, because Dr. Pauline Pariser launched SCOPE in 2012 as a means to help those patients that kept rebounding back into emerge. They weren't able to access the services that they needed. So she saw this as a great way to help these patients. She's a full professor at the Department of Family and Community Medicine at the University of Toronto. And she's recently stepped down after 4 years as the chair at the Midwest Toronto Ontario Health Team. Dr. Pariser is the provincial primary care lead with Ontario Health. So she reports about all things SCOPE to that group. So SCOPE was launched as a quality improvement collaboration between Women's College Hospital, University Health Network, and the Toronto Central Lynn Home and Community Care and Primary Care Physicians in 2012. So the first site was Midwest, so University Health Network and Women's College in 2012. And it was a phased approach, which a lot of sites do. They won't just launch, they'll say, we're gonna take X amount of PCPs. So their first phase was 30 PCPs enrolled and then worked their way up to 300. From one site, they went to 4 sites in Toronto within 2 years, and from 5 Toronto sites to all OHT Toronto sites and 9 outside of the GTA. Today, we have approximately 4,531 enrolled primary care providers. So it could be family doctors or nurse practitioners. And on average, through all of the sites, we get about 3,500 calls per month. Some of the sites, namely the sites in Toronto, are a bit busier than, say, our site out in Muskoka. I like to show this slide because it just shows you how many sites there are, how many PCPs that we've reached. Our newest site, I believe, is Grey Bruce. Actually, sorry, I stand corrected. Our newest site is Ottawa. And so you can see we go as far north as Bracebridge into the Bracebridge-Huntsville area, and as far east as Akwesasne. So we've got a good coverage here in Southern Ontario. Up to this point, I don't believe there's been any interest kind of further north in the province. So just some achievements of the SCOPE program overall. The overall provider experience when we survey, and we actually get testimonials back all the time, is how great the service is, how helpful it is not only to the doctor but to the patient. Timely access, improved care. When patients are surveyed through, because some of the sites have mental health as a pathway, they're happy with that as well. Through SCOPE, we do have some provincial programs. So we've got the RN health coaches, which work with patients who just kind of are struggling to stay on track, to understand what kind of their disease trajectory is, how to keep their appointments organized. So we have two RN health coaches. We have the Telemedicine Impact Plus program, which is a program for your very medically complex patients, where it's a multidisciplinary virtual visit that the patient and the family are invited to, but also the family physician or nurse practitioner are invited as well. The appointment will happen, and then at the end, there will be time for the family physician or nurse practitioner to speak with that multidisciplinary group of physicians that are on that call. We also have a connection into the headache program as well. So any of these programs, if you want to access them, if you think they'd be good for your patient, just reach out to me, and then I will make the connection into those programs. So system utilization, 80% emergency department diversion of the 45,000 contacts. The mental health program, over 800 patients. Appropriate use of e-consult and secure messaging. You're seeing cost reduction, improved appropriateness in DI ordering. Some of the SCOPE sites do have a DI pathway. And at this point, we don't have pathways in Durham, but it is something that is on the horizon that we'll work towards. And then the integration of digital technology. Here in Durham Region, we've recently launched on Ocean, so it's another way for you to access us. So now I'll talk specifically about the Durham program. So how the system works is you have a visit with a patient and you're not sure if the resource exists or who has the best wait time, or who can I refer this patient to. So then that's when you would reach out to me. You can reach me by phone, fax, Ocean, on the WhatsApp chat. You can email me. So there's several ways to get a hold of me. We'll have a discussion. You'll send over what you need, and then I will start making the calls, digging around for resources. And once I have a list, which I do like to provide a list, unless I know, or I've called an office and they're like, yeah, send it over, we'll get that booked in a week. Then I'll just send you that message and say, they're waiting for your referral. But if it's not that kind of response, I'll send you a list. Because it's nice to have options. Maybe you've had a bad experience with one of the physicians I've put on the list, and then in that way, you're not obligated to just use that physician. There's other ones for you to choose from. And we don't just, I don't just work with patients from Durham Region. I find a lot of doctors have patients who've moved further afield. So I've gotten very good at navigating over kind of in the Belleville, Quinte, out towards Ottawa, because patients just seem to be scattered everywhere. So just because your patient doesn't live in Durham Region doesn't mean you can't ask me to help you find a resource somewhere else, which I'm happy to do. So I'm available Monday to Friday, 8 to 4, general advice, assistance with navigating hospital community, scope services, searching for the appropriate resource in the hospital, OHT, communication, and expedited patient care where possible. The nice thing about the scope program as well is I can tap into that map that we saw a few slides ago. I can tap into all of those navigators. So if they have a pathway for something that you're looking for, I can tap into them and they will work on your referral with me. So if there's something in particular that you wanted at Sunnybrook, I have a contact at Sunnybrook. So you not only get my services, but you get the services of all the other scope navigators in the province, which is helpful because Toronto can be daunting when you're trying to find a specialist. So for me, even for me as a navigator, to be able to tap into them and ask their advice, it helps speed up the process and find what we need for your patient. So assistance in finding specialists, wait time, referral process. I'm finding I'm doing a lot of community-based things. Do programs exist? Is there a falls program? How do I get somebody connected to foot care? All of those types of things. I help with and find resources. And because I've worked in Durham Region for 22 years, I have a fairly good knowledge base of what's out there. And I have some fairly good working relationships with admins in the offices and different things along that line. What I will say is for I don't want to call them the easier referrals, but for the referrals, say, you've got a child that needs tubes and there's always a particular ENT that you use, you can keep doing those referrals yourself. You can keep having your office staff do those referrals. It's the more complex ones that need digging, lots of phone calls, that I'm happy to help with. I also don't fill out paperwork or call patients. Those tasks will still sit with your office, which I know for some offices, until I call and actually talk to your staff, they're a little bit hesitant to reach out to me. I've even had some of them say, well, you're going to take my job. And so once we kind of have that conversation about, no, I'm not here to take your job. I just want to take the really hard stuff that consumes your time. It really helps that relationship. And then they become more willing to reach out to me. And I'm happy to speak to your office staff because then that frees up your time. Let them know what you need. They can call me. I'll call back to them. And I've got a really good working relationship with actually quite a few of the staff in the offices now, and they have no problem reaching out. So there's all my contacts: phone number, email, fax. I'm under Scope Nurse Navigator in the WhatsApp community. I do try to respond in the conversation where I can, but sometimes you guys are just so good to each other that you answer before I get a chance to chime in. If I think it's going to be something that's a little bit more complicated or I need to ask a few more questions, especially in the WhatsApp community, I'll private message you. Just then that way it's not clogging up the conversation in the referral scope channel. So don't be surprised if I reach out to you and just ask some more questions and see if you want me to work that referral up for you. And like I said, we recently went live on Ocean, so you can reach out to me that way as well. And we're under Durham OHT Scope Nurse Navigator on Ocean. Pardon me. So these are our stats. since scope launched. So we launched May 6th, 2025. And you can see the referrals were quite low in May, but as we've gone along, we have increased. There's a dip in December. All scope sites see a dip in December because we all like to take that time off to be with our families. So I wasn't alarmed by that dip, and you can see the numbers have started to come back up as well. That number for April is incorrect. I just don't have all my data reported back to UHN for this month. We also break it down by how much time does it take to do the referral? Less than an hour, 2 hours to 4 hours, and you can see the breakdown there. So typically, I'm getting a referral. Usually I can get a referral done in a day. That being said, if it takes a while for a specialist office to call back or a clinic to call back, that sometimes can delay my response back to you. And you'll see, again, simple, moderate, and complex. So most of the cases are moderate. It takes a couple of phone calls for me to get the answer for you. And the complex ones, there's not too many of them, but it does vary from month to month, depending upon what the ask is. And I was quite excited last week. We now have 101 primary care providers registered to the program. My goal by the 1-year mark was 100. So that was a nice milestone for me last week. So I just thought I'd throw up a few cases. There's been lots of things I've helped with, but I just wanted to highlight kind of a few that were complex and just how I work with the other scope navigators. So case one is from when, yes, I can. At the end, I have a QR code and that you guys can take a picture of to register through the UHN website. So I will share that at the end. Thank you for the question, Dr. Kennedy. So case one is one of the first cases that I had when scope launched. I had a physician, actually 2 physicians in the same week, reach out. They had outstanding referrals to neurosurgery. And one of them had been for a year. So I reached out to the offices. I started making phone calls to find out, what's missing. What have we not included? Are you not able to get a hold of the patient? And so it turned out for the one case, the patient needed a new MRI. It had been too long since the MRI had been done. And we were able to get that patient, knowing that we were going to have the MRI done, we were able to get that patient booked within a month. And then the other patient was booked within 3 months. So I took that burden off those physicians. I made those calls. I waited for those people to call back and was able to find the answers, send back what we needed, and get those appointments sorted out. And in fact, in both cases, the office gave me the appointment to share back with the family physicians so they could let their patients know. So both physicians were happy to have answers. Why was the wait so long? And their patients were happy to have appointments. Second case, so we had a patient who needed pediatric orthopedic surgeon. Family physician was unsure where to send them in the region. So I collaborated with the scope nurse navigator at Scarborough Health Network, and she was able to take that referral, walk it over to the pediatric ortho clinic that runs there, and get the patient booked in quickly. So I was able to collaborate with one of my other navigators, and we were also able to get the patient booked in a timely manner. And then another case, OBS patient, 34 weeks along, needed a delivering OB, and they hadn't been able to find anyone for this particular patient. Several offices had declined. I called one of the offices that I had worked with in the past, spoke to the MOA there, and she remembered me and was quite kind to actually book that patient within a week into the office to be seen, to have their care transferred over. So that's where I was able to tap into, previous relationships, my time working in the region to expedite care for this patient. I won't read through all of these. They're just a couple of testimonials. It's quite nice to get that good feedback. But I'm also happy to take not good feedback because it's the only way we can improve the program. So if I work with you and you're not happy with what I've done, or you have, a suggestion, room for improvement, please reach out, because that's the only way that we make the program better and make it what works for you. So yeah, I've had a few family doctors who've kindly reached out just to say, thank you. Referrals were being declined. You took the initiative, you dug in, you reached out, and were able to get the patient managed. The last one talks about how, they were doing another task, and knowing that they had given this task to me, getting this sorted out, getting the patient booked with Sunnybrook, kind of took a weight off their shoulders, and they were able to continue with, what they were doing that day, which is it's nice to hear. It's always nice to hear the nice, but like I said, I also would like to hear the not so nice, because that's how I improve the program and make it better for you. Some lessons learned. I think if we were to go back to the beginning again, I think I would incorporate a roadshow into this. I would get out into the offices, get out meeting with you. I feel like that warm touch really helps to form the relationships. And that would also allow me to talk to your MOAs, to educate them, let them know what Scope's about, let them know that I'm not here to take their job. I'm here to actually help them and hopefully free up some of their time so they can deal with the tasks that are in front of them, deal with the patients who are in the office. I think pathway development is going to be important in the future. And again, I'm open to suggestions. Where do you see that there's a real lack here, or a real struggle, so that we can work and connect with those resources and hopefully get something good developed. And also, I would have, when we originally started, we had, if for those who registered with the program when we originally started, we had our own form. You registered and it came to us. I think I would do the registration through the Scope Hub, so that they could handle all of that on the back end, and get you registered to the program that way, because that would take some of the administrative burden off of us here. And here we go. Here's the QR code. It's a one-time registration. You register once, and like I say to some people, you can use and abuse me as much as you want once you've registered. You scan here. It will take you to the UHN hub, and you'll answer a few questions, and then you're registered. You can reach out to me by any one of the other means that I showed earlier on in the slide deck. And I can get helping you with whatever you need. Any questions? Any concerns? Did I go too fast? Would you like me to send out the slide deck? Happy to take any questions that you might have.
Thanks, Louise. We'll try and share this with everyone who registered, your slide deck, so we appreciate that. I just wanted to add in, Louise, that this is one piece of a puzzle that we're doing in Durham. So Scope, she talked about pathways. So there is a group working on integrated care pathways, and most importantly, working on how to have them designed from the primary care office as opposed to a top-down approach. This way, primary care is involved in helping build the pathways. So you will hear from the primary care network, as well as I think it's Dr. Eingren Sinaraja, who's a palliative care lead, but he's also leading the integrated care pathway, along with Louise and Lee, to help build out pathways. So we're trying to create the template. We also just met with Ontario Health to see if they'd be willing to help support us in a pathways company that's already built out hundreds of pathways and regionalizing them. So we're waiting to hear back from Ontario Health. So there's a lot of work going on this area because we know it's a big burden for primary care, and trying to make life easier for everyone and take some of that burden off. So if anyone has questions, please put your hand up or put it in the chat and we'll go from there. We'll give a couple of minutes for that, and then we'll move on to our next speaker, given it's been about 25 minutes. So we'll get Suleiman's first talk, and then give a little break, and then we'll jump into a second one. Thanks, Dr. Jensen. Agree, it is a great service. Maybe Louise, you can go back and put up your QR code so people can scan it while they're waiting, if they want to register.
Sure.
Nope.
Yeah, I'm not. There we go. PowerPoint does not like me.
All right, if you do have other questions, you can still put them in the chat and we'll reach out to Louise to connect you. But we will move on to our next chat on this Friday morning. So I'm going to introduce Dr. Firmly. Thank you, Louise.
Yes, thank you so much.
I think Dr.